Now, how well is it going? It's a humongous job, and I imagine there are also technical aspects of it. Now, hearing the National Cash Transfer Office, which is also known as Household Uplifting Program, how well has it been going so far?
Well, thank you very much for having me.
It's our pleasure. So I wanted to know, how well has it been going? There was a recent report that a sizable number of people had actually been captured digitally. So when I'm asking how well has it been going, I imagine there are technical aspects to actually determining qualifying households. So maybe you could start from there to sort of help us understand this program, which has been referred to as a safety net of the federal government. How well has it been going in terms of organizing for it and being able to do what the name of your program actually is, transfer cash to qualified, deserving, and needing households?
Thank you very much. As the name implies, Household Uplifting Program. When the present administration of General Muhammadu Buhari came on board, one of its main mandates is to tackle poverty, which has been on the rise in this country. Research has shown that over 40% of Nigerians live in poverty. This means that about 83 million Nigerians are living below the basic human needs. To address this high level of poverty and to prevent societal collapse, the President of General Muhammadu Buhari started the Household Uplifting Program, popularly known as Conditional Cash Transfer, in 2016 with the Abacha restituted funds. By 2018, the government went ahead to partner with the World Bank to develop and design a social safety net program. By so designing that program, 2 offices were established. One is the National Safety Net Coordinating Office, which is in charge of the National Social Register for the poor and the vulnerables. And the other one is the National Cash Transfer Office, which I am the coordinator. The office serves as the implementing office. The program development objectives for the National Cash Transfer Program is to improve household consumption, to also improve school enrollment and attendance, to improve health management and sanitization, and to also increase nutrition amongst the poorest of the poor and the most vulnerable. We call them the unreached in the country. Through a targeted transfer of 5,000 naira monthly. So to get to our beneficiaries, as you all know, like I mentioned, they're the poorest of the poor, they're unbanked, they live in the informal sector, they're no literates. First and foremost, let me start from the targeting. We target the beneficiaries, or we mine from the National Social Register. That is our sister office. They go to the field to target the beneficiaries based on a globally acceptable targeting method. By the time we mine the beneficiaries from the National Beneficiary Register, A team of enrollment officers from my office pay visit to the communities to validate the number of households targeted. On validation, and if we're satisfied, we get this household members enrolled into what we call our National Beneficiary Register. Once they're enrolled, we do an electronic data capture, and we give them ID cards, which it's a means of identity to say that, okay, you have been enrolled into this program, and this is what you're going to be using when we come around for payments. This is how far we validate the beneficiaries. So we interface with these beneficiaries. We pay visit to their communities for coaching and mentoring, for sensitization. Because one thing Nigerians even need to know is that we don't only give the cash grant and move away. We keep going, paying visits to the communities. Because they're, like we say, most of them live in the remotest of areas, and they're unbanked. So the program started as an offline program. Physical cash is being given to these beneficiaries. And the challenges in this visitation is that most of those areas where we go on a monthly basis, there are a lot of risk. Getting to our beneficiaries on rough roads, sometimes at the riverine areas, the staff of cash transfer office have to be in a boat. They can't even come back on the same day. They end up sleeping in villages, and a lot of risk. We have lost a number of good humanitarian workers during these exercises. A lot of people keep asking because they don't give us a list to pay their people. This is one very unique program that the country has never had. All our beneficiaries are not related to anyone. They are not related to the president. They are not related to the minister herself. They are not related to myself. They're just beneficiaries that are Nigerians. They were targeted as being the poorest of the poor and the most vulnerable. That's the beauty of this program. You don't have to know anybody to qualify.
Okay.
I have personally experienced life-changing situations on these beneficiaries because the program has financially and socially included these beneficiaries. They were hard to reach. They were not connected to people, you know. But with what we have done so far, especially now that we have fully digitized the payment system,
okay,
we have succeeded in opening over 1.9 million accounts across commercial banks, microfinance bank, through our payment service providers who are licensed and regulated by CBN. And most of the time, you hear Nigerians saying, we don't do these cash transfers. But records are there to see. There are a lot of accountability process in this program.
Okay. Now, thank you very much, Hajiya. The other thing is it pan-Nigeria, or are there areas of greater need than others? Or is this program rolling out right across Nigeria?
So when I started, I said about 83 million Nigerians live in poverty. And the program is just in 2 million homes. We pray to get a funding that will cover the whole 83 million.
Okay. So
For now, we're just in 2
one
million
step before
homes.
the other.
And the 2 million homes, 2 million homes translates to about 9 to 10 million individuals. The program is in 36 states of the FCT, is in 613 local government, across 48,000 communities, and in about 7,000 political wards. A lot of funds have been spent to see how the delivery system will be sustained. And in all of these areas that I mentioned to you, we have from state coordinators to local government staff, to community staff, to desk officers, and even a grievances redress officer in every of the community where we have our beneficiaries. So our beneficiaries go to their grievance officer to register their grievances.
Indeed. Now, you did say that this is actually, it's in partnership with the World Bank, if I heard you correctly, because they are usually interested in those kind of things. And since this program is really to address, shall we say, where there are deficiencies in capacity development, I wanted to ask you, no doubt your office and, ancillary agencies must have put a lot of study into it. You said 5,000 naira, is being made available where there was nothing before. If one understands it the way you must understand it, explain to us how 5,000 naira, and I imagine it's going to be periodically, perhaps on a monthly basis, how it is that can be as helpful as one would want in these inflationary times.
Yeah, so I really love answering that question because most of the time we get challenged by people saying, you're giving out 5,000 naira. What will 5,000 do to someone? How come 5,000 naira lift someone out of poverty? And my responses to those people, like I always say, is that's why you are not a beneficiary, because you don't even look at 5 naira as money. So like I told you, we're targeting the poorest of the poor and the most vulnerable in the remotest of communities. We go to communities where 200 naira is money, and then you're being given 5,000 naira on a monthly basis for 3 years. And then you receive a lot of skill acquisition training with a lot of sensitization, coaching, and mentoring on how to enroll your children in school. So the improvement, or what we have seen as impact with these people, is that not only are they empowered now, they have also enrolled their children in school. They visit healthcare facilities, and there is a core responsibility component to this program. Once the households pick up one core responsibility, if it is enrolling your child in school or visiting healthcare facilities, you're entitled to another 5,000 naira. So instead of getting the 5,000 naira alone, you are getting 10,000 naira. And then with the coaching and mentoring skills we give to our beneficiaries, at the end of the 3 year, and we find out that you have a skill already that you have been investing in, and you're entitled to 150,000 naira grant, which we call the Livelihood Grant. This is to say that, okay, we have exited you out of this program, and since you're already empowered and you have a skill that you can rely on for sustainability, this is a one-off grant of 150,000 naira, to boost your capital. It will also interest you to know that we have done a lot of savings and income mobilization training to our beneficiaries. So we have from cooperative groups to enterprise groups to savings and mobilization groups within our beneficiaries. From what we give to them, we encourage them to save. So out of their savings, they form these groups. So sometimes when you look at all of these groups, which we have also opened account for them you will see a lot of savings. Our beneficiaries sometimes can loan themselves from 100,000 naira to 500,000 naira. They could actually buy farmlands. There's a video of mine that I made a visit to a village or to a community of our beneficiaries in Kano. You know, they now have farmlands. They grow rice. That community is called Kura. I wish you had the video. And these beneficiaries, when I interviewed them, they said before this program, they were being employed by other members of the community because they were seen as poor and they couldn't afford anything. But now through their savings, they were able to even buy farmland. They now grow the rice, they process the rice locally, so they are now employees of labor in their community. And this cuts across the 36 states and the FCT. We have lots of documentaries on this program, and we have lots of positive impact on the successes of this program.
I'm glad to hear that technology is involved, because I was a bit concerned when you were explaining that, look, to put this in context and perspective, you're really targeting the poorest of the poor in the very remotest areas of our country as a special need, and you explained how, with that understanding, 5,000 naira in an urban setting, you know, that would not look like very much, actually you've just explained how the folks there are actually able to save out of that. And I spoke about the technology aspect to it. Does that mean that you are encouraging them to also engage with technology? Because what is having a bank account these days, if not engaging with technology, because you also spoke about cards, and how are they able to work within this? I know that you can't do without technology, but the end beneficiaries themselves, how has that been? You know, engaging with the technology that is involved, so that they, at the end of the day, they have something in hand that they're going to be able to use.
So to make accountability process transparent and to financially include our beneficiaries for other future interventions, not only restricting them to the National Social Safety Net program, we hope it will be an ongoing inclusion on our beneficiaries. That is why we fully digitized the program. It was very difficult from the beginning to tell someone who has been unbanked, who has no access to the banks in itself, to even convince them that we are going to open accounts for them, we are going to distribute ATM cards, we are going to keep their money in the banks, and they have access to their monies as at when due. It was very difficult, and a lot of financial literacy has been put in place. And you know, the kind of financial literacy training you give to these beneficiaries is not like the one you and I will understand. So we have to even, going through the digitization, we had to improvise means of teaching them all of this. Sometimes we make posters, we distribute flyers, we visit their community heads, they translate the training in the language they understand the most. So by the time we started, some of them were just not comfortable to say, my money is in the bank, all of my money, you people don't want to give me. But we made them to understand that it is the safest way of keeping these funds, and this is for their own good, because next time an intervention can come, or a kind of grant or a loan without even an interest for them, which they may not be able to benefit. So we train them on the opportunities. Coaching and mentoring sensitization on this financial literacy is still ongoing within the communities. But so far, so good. They're catching up, or most of them, the speed at which they caught up is amazing.
Okay, then. Sorry that I chuckled, Hajiya, because when you use the expression "so far, so good," my mind just went to Kole Baje. But no, I'm sorry about that.
Oh.
Now, you know, thank you. I'm sort of trying, I'm getting it a bit better. Let me understand the household uplifting aspect of the name and this 5,000 naira grant. Now, you register households. Now, in one household, I'm statistically speaking now, there might be 5 people, mother, father, 3 children. In another household, there might be triple that. Now, what happens here? Does each household get that figure, or do individuals within that household, is the calculation factored in to take care of the individuals within that household, since there will be variations in the sizes of households? Is that a concern?
Yeah, so as far as, normal setting of household is concerned, we look at least five people. 5 people, but in a place where we meet, like Nigerian setting, African setting, you meet a family with 30 people. We register the first 10, and it's not that every person is entitled to 5,000 naira. No, one household gets 5,000 naira. Like I told you, there's a human development component of the program, which is a core responsibility of every household that is part of our beneficiaries. So if we come back after all the coaching and mentorings and we find out that you have enrolled into one of the core responsibility of the program, you are entitled to another 5,000 naira, which we call the top-up.
Now, another question. Who is the recipient on behalf of the household? Is it the matriarch, the mother of the family, or is it the father? Who is the point of contact into the household?
So we usually give the family an option to select a caregiver and an alternate caregiver. And most of the time, they select their women, that is the mothers, as their caregivers. So as it is in our National Beneficiary Register, 94% of the caregivers on this program are women.
Okay. It
is in the absence of a caregiver that an alternate caregiver can be the father. And sometimes if they have an older daughter, they usually suggest that she represents the family.
Okay, so this program is run, from what you're saying, the way I'm getting it, in conjunction with consultations with the people themselves. I mean, you come along with all the science and all the knowledge and all the research, but it seems to me that you also engage with them so that it's a program with them as opposed to a program that they can't feel a part of and probably think that they don't own. Is there any sense to that?
The engagement with the beneficiaries is part of the social inclusion aspect of this program. That's why we pay monthly visits to the communities. We interface, we engage them in a lot of activities, because you see, with an interaction, a face-to-face interaction, there is more result than any kind of interaction.
Concentrating on the part you spoke to us about, this program really aims itself at the remotest areas, areas where human capital deficiency, development deficiency exists. And then you said that some of the successes of it is that people are now able to access perhaps facilities, services that they hadn't been able to access before, such as banking, for example, and that kind of a thing. Those facilities are not usually available in the very remotest areas. Correct me if I'm wrong. So there's a sense in which, as a result of this program of yours, the household uplifting program, are you sort of introducing them a bit more to the more urban areas where these facilities are more plentiful? Schools, for instance, hospitals, or clinics? Oh,
yes, I didn't hear all of that, but I caught the last part.
Okay, I was saying, since they are in the remotest areas, the people that you primarily target are in the remotest areas, how do they, is it part of your visiting with them and engaging with them that you sort of introduce them to services that are not available in those remotest areas, such as schools, banking, healthcare, and those kind of things that are going to be of benefit to them?
Exactly. Most of them, when the program started, didn't have their children enrolled in school. Like I said earlier, part of the program development objectives is to improve school enrollment and attendance, with including visit to healthcare facilities. So with the coaching and mentoring sensitization that we've been giving them, because if you're uplifting a family, you need everybody in that family to be well. You need them to have access to education. So you find out that even the areas where they don't have community schools, as part of their community social responsibility for beneficiaries that are in this program, from their savings, you will see how much they have done. I don't know if you have some of our documentaries where some of our beneficiaries have contributed to buy themselves a vehicle that can transport their women to hospital. And when you interview those beneficiaries, they will tell you that they have lost a lot of lives because they didn't have a means to get to the hospital. But with the program, the Conditional Cash Transfer Program, they've been able to save, to feed their families. They've been able to enroll their children in school. They now visit healthcare centers. A lot of them even take care of their community health centers with their savings. When you visit some communities, they drag you to see what they have done as part of their corporate social responsibility. You see that they've painted their community hospitals. They have bought a lot of things that are absent in that hospital just to make life better. In fact, by the time you're interacting with our beneficiaries now, you would definitely know that it wasn't the way we met them before.
And this is
they have been socially and financially included.
Indeed. And this is coming from what to a lot of people might seem an extremely modest contribution of 5,000 naira per household. This is all coming coming from all of that. Hajiya, there are three components, because this does need a bit, some sort of understanding. And I think, even if I say so, you've been quite clear to help us understand it. There are three components, is what our research says, going by even data on your website. Maybe you can help us understand those three components to it. One is base cash transfer. Two is top-up based on state-selected conditions. And three is livelihood support. And could you help us understand those? Sound a bit like technical terms, but base cash transfer. What is that?
So the base cash transfer is the 5,000 monthly grant which everybody in the National Beneficiary Register, every beneficiary is entitled to.
And you've explained that the beneficiary doesn't mean that if there are 17 people in a household, it is 5,000 times 17 places. No, you've explained that. It doesn't work like that. In fact, you count statistically at 5.
Yes.
But
and even then the top-up.
Yes. Please continue.
The top-up is the second component of the program, which I said is we call the human capital development component, which I said a household has to pick a core responsibility that they will be doing. That is like enrolling their children in school or finding a healthcare to be visiting. So in our periodic visits, when we find out that such households have enrolled their children in school, we follow up with the school to see the school attendance from the register, because we don't just stop at are there. That's why I said a lot of interfacing and interaction with the beneficiaries have made them to socially connect, you know, to us and to a bigger society at large. So when we find out that there is improvement in school enrollment and attendance in one of the households, you are entitled to another 5,000 naira, which we call the top-up. That's the second component. So not every household is entitled to the second component unless you take up a core responsibility.
Mm. And
then the livelihood
support.
Yes, the livelihood component of the program is what a household is entitled to. So the tenure, I would say, or the lifespan of the program is 3 years. So if at the end of the 3 years of a befitting households, we find out that out of the skills acquisition training we have been given to the beneficiaries, a household member of the beneficiary has taken up into skills, then at exit you are entitled to 150,000 naira grant as a household. This is to say that this is a capital to boost your business and to make you be able to stand on your own since we're exiting you out of the program.
And you've explained that they've put it to such good use. These are some of these facilities and grants that they're actually able to, in some cases, buy vehicles which are going to be, I mean, things as gigantic as that, putting it in the context of a 5,000 naira seed program. And as you said, at a certain time, it's possible to get even up to 150,000. So this much has been done. Now, Hajiya, I want us to talk about, at the beginning, this program, this laudable program, you said that unfortunately you've lost people, staff members, trying to execute this program because of the terrain or because of what? Because of the conditions under which people have to work to make this program workable, quite frankly.
Yes, it's part of the working conditions because we have to get to the beneficiaries. So sometimes when we get to those remote locations, you know, someone gets sick or they're traveling by road, we may have accident or something like that, and we get to lose lives.
Okay. So it's hard going, but nevertheless, this is a thing that your office and some Nigerians in there are sort of strenuously committed to, that it must continue. But you said it's you said it's 3 years in the first instance, this particular initiative. Is it in the first instance or is it a one-off?
Can you come again? I didn't hear that.
The duration of the of this program you said it was 3 years. The National Cash Transfer Office, also known as the Household Uplifting Program, it's for a duration of 3 years?
No, the length at which a beneficiary will be benefiting from this program is 3 years.
I see. The program continues, but
yes,
having...
So if, yes, the program continues.
Okay, but if you've benefited for up to 3 years, then you have to go to somebody else.
You'll be exited, and other households will be enrolled.
Indeed. Well, you know, thank you very much, Hajiya Halima Shehu. Is there something else that perhaps I haven't asked that you think it's going to be useful to give perspective to our viewers that they need to know that you would like to add?
I like to mention the accountability process. To some extent, a lot of people think we're not doing this work, or we pay what we can pay, and Nigerians keep asking, where does the money go? So for their understanding, this whole funds of Abacha restituted funds and the World Bank funds that are being used to fund these programs are domiciled with CBN. We have an account in CBN. And then we have procured payment service providers regulated and licensed by CBN to deliver this payment to the last mile, to our beneficiaries. So CBN does the disbursement of these funds to the payment service providers' accounts, which they monitor themselves. And then each payment service provider has a data of the states, the communities and local governments where he ought to be making payment. They go to the field. They are online real time. Even when we were not fully digitized, the app they use while making payment is synced to our management information system data, which means whichever payment they're making, either they're online or offline, it is synced with the dashboard in the cash transfer office, to which we monitor payment whether we're on the field or we're not. And then as soon as they make payment, it drops on the dashboard. So once they complete a payment cycle, they return back to the cash transfer office. They sit with the officers that are charged with reconciliation to reconcile exactly the paid balance, the paid amount on the field. And once reconciliation is done, the exact unpaid amount to our beneficiaries is remitted back to our CBN account. This is how transparent the cash transfer office has been. And it will interest you to know that there are a lot of monitoring teams on this project. We have civil society organizations. We have INGOs monitoring this program. We have independent monitors from the ministry, from the Office of the Auditor General. They always monitor this process as well. So there are a lot of monitoring teams, even on the field. And we have a lot of auditors monitoring us from time to time. And reconciliation is being done at National Cash Transfer Office on a monthly basis. So this is how transparent this program is. We know we're doing it, and would like to tell Nigerians that not all programs are fraud.
Indeed. Also, it's a matter of one step at a time, because some people might say that they've not heard about this program yet in their area. But I think you said, what, up to, what was the percentage you gave at the beginning of the program of the noted poor? Is it between 40 and 60% of Nigerians? And you've just said that maybe 1.9 million, the details of 1.9 million of the affected have been, captured digitally. But so if somebody says, I've not heard of this in my area yet, what would you say to that kind of a person?
I have come to understand with Nigerians that anything they can't influence means it's not happening. Because a program of this size, we're out there. We usually present ourselves to media. Our minister is the most visible minister in this country. We're always traveling from one state to another to carry out all the social investment program. So with Nigerians, anything they can't influence, anything they're not, you're not saying, please bring your own people, let's include them. They believe it's not happening.
Okay.
So I really would like to tell Nigerians to change their perception.
Okay. And as you have said, you said at the very top, you don't have to know anybody to be a beneficiary of this, neither the minister, neither the president or presidency, neither your good self. This is something that is going out to all Nigerians that are needy and that have, suffered a lack of human capital development. Well, I want to thank you once again Hajiya Halima Shehu, National Program Coordinator, National Cash Transfer Program, an arm of the Federal Ministry of Humanitarian Affairs and Disaster Management. Thank you very much for your time.
Thank you so much for having me.
Indeed. Okay, then. We can take calls in case there are calls, for comments. She won't be able to respond to questions, as you can understand, but what people feel about this initiative. She explained how it's 5,000 naira, and she also said that will go on for about 3 years, after which those beneficiaries, hopefully, there would have been some sort of a critical mass, and so other people will come in. So you won't be able to benefit at that 5,000 naira a pop for more than 3 years. But she explained how, it really is helping the people. I have someone in from Akwa Ibom. Is it Major in Akwa Ibom?
Yes, Major Ubon calling from Seribum in Akwa Ibom State.
Good morning to you. Please go ahead. What was your comment?
All right. Thank you very much, Uncle Jerry.
Yes, sir.
My comment is that I want to ask your guest, and please, what is the statistics that is being used to get? Can you hear me?
Yes, we can hear you.
All right. What is the statistics that is being used? Because it's like the people that are mostly, participate or gain much on this program is the people from the northern side. Then secondly, what is the mode of what is the mode that is using to get this? Because I think this thing will even be paraphrased from poverty to more poorest of the poor. Because like now, what is the mode? Like I remember once when this kind of program came, they wanted to give fertilizers to the farmers in the village, but it was that thing changed to be a political a kind of empowerment. They use the village aid or the chairman, in which they include the names of those that they love or all those things. So I want to know the mode. And finally, please, it's our same ministry that gave during when the student was in the house, they said a kind of palliative to school children when they were in the house. I won't see a ministry. Thank you for having me. I'm Major Oba. I'm calling from Seribum in Akwa Ibom State.
Thank you very much. Those pictures, by the way, you were watching as Major was speaking, are actually from Bayelsa State, for example. And it had been explained by Hajiya Halima Shehu that, actually they're doing what they can and it is going around, but that she had the impression that sometimes Nigerians don't believe a thing is happening if they haven't been reached and been told to bring your people and that kind of a thing. So she said you have to understand that, but they are proceeding, as they can. 1.9 million out of about what? I don't know, 60 million people reportedly that are in that, poverty, most needy cash it. Now, Emmanuel. Good morning, Emmanuel.
Good morning, Uncle Yori.
Good morning, sir.
I greet your guest.
Okay, then. She's left us now.
Yeah, I laid the foundation yesterday before I couldn't go through.
Yes.
I want to reiterate it that the TVC has done us well and done us proud by giving us the opportunity to continue to call in like this.
We
thank God for TVC.
Thank you very much.
I have two things to say.
Yes.
One is an advice. The other is an appeal. The advice is this, sir. Whenever you bring in your guests to discuss any topic, depending on the sensitivity of the topic and the security implication, if it is so sensitive that it may ruffle feathers, that will make your guests uncomfortable and make you sit on edge, or rather not contribute. So place a caveat, no cause for that day. We, the viewers, are willing to watch seamlessly to the end. We will understand. Because we don't want to ruffle feathers. Somebody like me who cannot compromise the truth, I don't want to go and commit handball. And if you know,
but what are you talking about? What subject matter are you talking about?
No, when we bring in any topic if it has a lot to do with security of the nation
Okay.
and the sensitivity of the nation.
All right.
I am feeling that we'll be proactive by placing a caveat so that we don't call in guests and not to ruffle feathers.
No, okay, I hear what you're saying. Thank you very much for calling in, Emmanuel. I hear what you're saying, but we don't do that. Look, if a topic can be discussed publicly, we will discuss it. We don't do what you're saying here. There are a number of factors, but I appreciate the comment that you are making, but we don't prevent the inclusion of our viewers' opinions. We don't. It might coincidentally happen that there are technical issues, but not that we intentionally go out and say, we don't want people to comment on this. But I hear you. Thank you very much for contributing, Emmanuel. As always, we deeply appreciate you, as we do all our other callers. In fact, we're going to have to leave it here, learning a bit about reducing poverty through conditional cash transfer. It's a technical term, as it was explained to her, because it's also known as the Household Uplifting Program. That's our program today. Please join us tomorrow for a fresh edition. I am Yori Folare. Bye-bye for now.